He's just an amazing guy to work for, right? Like just the clinic that he had, yeah, he was like, reuse everything. If it's not broken, it's good enough. If things were held together with duct tape, you're like, Dr. Boey, right? But it was a nice environment, and like attracts like, and he's that kind of a person. And so even the people he would hire were all those kinds of people. Like he never fired a person in his life because he didn't have to, because he always just attracted those good ones. And if it wasn't really the right fit, they just sort of managed to do it on their own. Like it wasn't and then, yeah, you're just like, you're never gonna go. So now I've made this as my retirement plan. I can be here forever. Oh my goodness, kind, 100%. Funny. Once you get to know him, the things and the jokes and the practical jokes and the, every day that Botox would arrive, you'd have dry ice in your water. You'd just be smoking when you came back, or your coffee. You're like, I don't even have time to make any coffee. You've just ruined my coffee. He's like, you can still drink it. You're like, drink, it's got dry ice in it. So he's good like that. He's good like that. Practical joker. He's just got that heart. Like he's the nicest person. He would do anything for you. Fair's another one. Like he's just, he's a good guy. He's a good guy. And had I started this journey at a different place, who knows if I would have stayed. He didn't want this place to look like white marble and leather, because then the patients are like, oh, so that's where my $2,500 thermage went to, right? Like, it's clean, it's medical. It was always medical. That was the other thing when I first came. I was like, we need a product line. He was like, no, this is a medical facility. This is not a spa. Never wanted to be a medi spa. We do lasers here. You want a facial? There's 80 million places out there that do facials. So, Dr. Boey's rare. Is that another adjective I could use? Rare breed, not Dr. Boey. Right? Like to have an employer like him is rare. Patients, every time they would walk in, I'd sort of get things started. You bring the doctor in just to have a little, okay, yeah, this is good. The little bit of banter that him and I would have, or he would have with them, or this or that, he'd walk out and the patient would be like, this must be a fantastic place to work. And you're like, it is.